Ramsay Connect is a joint venture that was formed between Ramsay Healthcare and Remedy Healthcare in early 2020. The joint venture was formed to bring together the capabilities of the two organisations, stretching across hospital care, community care, and remotely and virtually delivered healthcare models. Our organisation is focused on helping reduce the rates of potentially preventable hospitalisations, particularly for people living with complex chronic conditions. We do that by supporting primary care to be even more effective to help people manage those conditions in their own home. We also integrate with specialist care where it's required as well. Australia's healthcare system faces a number of sustainability challenges in the longer term. We're in a very fortunate position to work with partners such as public health and government to challenge the way that services are currently delivered and to innovate, evaluate and hopefully in the longer term scale those services to be part of the solution.
With the Australian healthcare sector being quite siloed and having so many different components, it's really hard, almost impossible for any provider to be everything to everyone. So I think that it's so important to be able to partner with different areas, so it means that each service can focus on what they're really good at and what they've got practice in. So I think our virtual home health service is really looked at what services are currently available for patients, but what are the gaps as well. Being able to actually address some of those gaps and work in partnership with some of the existing services mean that patients get a much better service, and in the end you're getting a more cost-effective service as well.
Working as a GP in the community, but also as a doctor in the emergency departments, I did see a lot of patients representing with an exacerbation of their chronic conditions. Quite often heart failure, COPD, chronic kidney disease. Very frequently, those presentations and readmissions were preventable. The virtual home health service is a great palpable solution to reduce the risk of errors, to improve education amongst patients and GPs, and overall improve patient outcomes. It's a very structured program. It's multidimensional, multidisciplinary, but also tailored to patient care needs. And that is very, very important. The current data from patients enrolled in this service shows an improvement in patients' mental health, and most importantly, an improvement in their quality of life, in particular social limitations.
Not a day goes by currently where we don't hear of the crisis in the healthcare system, especially around workforce. Recent studies have shown about 85,000 nurse shortfall by 2025, and we're currently about 6,000 GPs short in Australia. So the workforce problem is huge. We're able to tap into nurses anywhere in Australia and workforce anywhere in Australia, especially those underutilised workforce. So you know, a mum sitting in Tasmania that can offer the hours of 9:30 till 2:30 and delivering care from Tasmania into regional Queensland. So by partnering with us, there's a really exciting opportunity right now to rethink not only patient experience, but also clinician experience, and really sort of try and build sustainable models of healthcare, not just for today, but also for the next 10 to 15 years, and for the future of healthcare in Australia.